Well, all right, here we are once again. Here it is, Pastor B's kitchen table. You know, this is the place where we break it down, chop it up, and put it back together again. So go ahead and invite your family and friends and tell them they're back at that table again. And this today, we've got a wonderful, wonderful group of guests. I mean, a group of guests. And we got some information that you're probably not even aware of. And yet that's why we're bringing it to you here at the kitchen table. This is going to bless your entire family tree, to be honest with you. So I want to just open it up by saying, Sister Shirley, will you say hello and just tell us who you are and also your partners?
Thank you. First of all, I want to give honor to God, who is the head of my life, and then give gracious honor to Pastor Hamilton for inviting me here today to just discuss a little bit about healthcare and mental health care and substance abuse care. My name is Shirley Clark. I am the program director of Elevate, which is a substance abuse program within the behavioral health system here at Access Health. And I am so glad to have this opportunity to share about what our programs and our medical center offer, and hope that I can help someone to be able to know that in this time of crisis, that you're not alone and that there are services ready and able and willing to provide multiplicity of services for you.
Okay. And so how long has Access Health been around?
Access Health has been it started off in 1975 as Fort Bend Family Health Center. It primarily was a WIC service for women, infant, and children in the Richmond area. It gradually graduated over 40 years of service as a health center. We have 5 locations. We have a location in Richmond, which is where I am primarily stationed, which is our main location, Stafford, Missouri City, Brookshire, and East Fort Bend, which is also in the latter part of Missouri City within the Chinese church.
Okay. Wow, that's some. And so for those who are listening who live in Fort Bend County or they're able to make their way to Fort Bend County, what can they expect if they make contact? Who should contact you?
Great. Well, you know what? We're nestled in communities. We're right there in a household community. Some of our patients are just a couple of doors away. So we do that primarily because we are a family center. We want to be a part and be in touch with the community. So it's real simple. They can just simply call our main number, which is 281-342-4530, and sign up to become an Access Health patient. It's real simple. Only thing they have to do is bring that ID, proof of residency, and proof of income. If they don't work or don't have the ability to pay, don't have insurance, we turn no one away. We have affordable health care. So we find the funds to be able to provide people who do not have income, do not have a job, do not have insurance, health access to health care. So some of the services we have here at Access Health is we primarily have adult preventive care for both adults and children. We have pediatric and adult clinics. Wow. We also have well women's services for prenatal care and after delivery. We have dental, we have behavioral health for those who have mental health diagnosis or dual diagnosis. We have HIV medical testing and treatment, immunization. We have nutrition for those who are having chronic diseases that need to get back on track, like diabetes and heart failure and some of those things. We have care coordinators. We have a team of individuals that try to help them find resources within our community to make sure that they have total wellness. We are a trauma-informed care, integrated care system. We are a one-stop shop. You know, once you go and see the doctor, you go straight over to our pharmacy. We have affordable medication. If the doctor needs lab work, you go straight down the hall into LabCorp, which is nestled right here in our main facility. So you can get testing. Everything that a client needs is here. Now, I would like to say that my program is a little special because we just started like in 2018 because I have been 20 years with addiction specialists. And so I deal with dual diagnosis. I deal with the mental health issues as well as the substance abuse issues. I too know that you can be saved, sanctified, and addicted. My brother definitely, you know, my father was a pastor, so we grew up in the church. We knew a God. We served him well, but he still got addicted to drugs and alcohol, right? So it was like 15 years of battling. What do we do? You know, my father definitely prayed. We did the prayer line. We read scripture. We tried to do all of those things from a spiritual perspective, but it still needed a physical touch, which definitely came in place with counseling. So it motivated me to figure out, what do we do, especially for those who are believers? Because oftentimes as a believer, we feel like we don't want to deal with secular medicine because it tests our faith. But I am here to say that, you know, I'm a Christian counselor as well. I got degrees in secular counseling as well as Christian counseling. I do blend the word with what I do when patients come in. I'm sensitive to the fact that I know that there are barriers that prevent people from getting the help that they need, but the help is available. And even in the word, it says that there's safety in counseling, right? So every now and then you just need to come and get the help that you need. And so in my program, we deal with psychoeducation. I'll let Fanta Hartwell, she's one of the counselors in my program, be able to talk about it from her perspective. But we also have medicated assisted treatment, because guess what? Grandmother went to get some opiates for that arthritis pain and knee pain and hip surgery. Now she's addicted to the medication. And so that's where I come in. Our medicated assisted treatment kind of helps them get off of that medication. We definitely educate them about other alternatives to medications to be able to deal with the pain, because it's real. You know, people have issues that are very real, but there are alternative ways of treatment that does not require that you take medication. But if they are addicted to medication, that is also real. And so they can't just stop, because they could die, you know. So we try to titrate them to a place of safety.
Right. Wow. So Shirley, you have said, I have so many questions for you. You said so much. Okay, first of all, introduce us to your team.
Okay, so today I have a mixture of spiritual advisors and supporters and co-workers. So Fanta Hartwell is one of our expert counselors. She have a wealth of experience in substance abuse counseling. She has worked in this field for a number of years, and I'll let her share a little bit about her experience as a counselor and as a young mother of teenagers, because we see a lot of teens now that are using drugs. So little Johnny is just not going to school. He's also going to school, and his friends is giving him drugs that he's addicted. The youngest person that we treat in our facility that have a substance abuse issue is age 13. So don't be surprised, you know, don't think that you have to be older to have access to some pretty illicit drugs. So Fanta, would you like to share your experience?
Hello.
Hello, Fanta.
Thank you guys for having me today. My name is Fanta Harwell, and I do work with Ms. Clark in the on the Elevate team. I'm a subs counselor, but right now I'm working closely with adolescents. I have worked with adults throughout my career. However, my specific group that I'm pouring in on right now are the adolescents, and as Ms. Clark said, yes, they start really young. You know? So we're developing, well, we have developed an adolescent group that we have on Wednesdays from 5 to 6:30. And it's growing. You know, we're reaching out and connecting with all the parents. And one of the problems that we're running into is many parents feel very uncomfortable talking to their kids about drugs, because they have this misconception that it's going to trigger their interest in it. Well, no, they're already interested. They're already talking about it. They're just having misinformed conversations with their peers. So, you know, what our organization has done is created a safe space so the parents can actually learn, because we have town hall meetings that we have throughout the year where we do our best to educate the public and the parents on high-risk behavior to look for, on signs of drug use, you know, certain things that kids have. We have we partner with community organizations to come up with, to show them different devices that kids use, you know, because things such as like one meeting we had, they had pens, you know, you see your kid with a pen, you're not thinking anything of it. Well, that can be a vape, that can be something they're using to use nicotine and marijuana and meth. You know, they're liquefying methamphetamine, and yes, teenagers are using amphetamines.
Yeah.
You know, back in the day, children would start off with cigarettes.
Right.
Now we're seeing they're starting off with opiates and amphetamines.
Wow.
So, you know, that's our target population right now, because if we catch them at the beginning, then they won't make it to the adult part. You know, we
Yeah.
do a lot of preventative care, you know, so Ms. Clark and I had the pleasure of speaking at the day at the Capitol, and one of the bills was about increasing the funding for prevention. And you know, what's the importance of having funding for prevention education for parents and in school to develop programs for our school systems, so we can get more treatment in there, get more counselors such as myself and Ms. Clark in there. So, you know, we need all the parents to, you know, write your legislator, you know, call your representatives and let them know, you know, this is a problem in our community, it's killing our children. We have a high risk of we had in Fort Bend County, we had over 20,000 middle school kids last year admit to using substances stronger than marijuana. So, you know, it's a big problem in our community. So that's what I do. That's what I'm focusing on right now. I work with all the population, but right now, it's the teens, it's the adolescents that we're focusing on.
You know, that's amazing, family, because certainly in Fort Bend County, in certain parts of it, you know, it's pretty progressive. You know, it's people have resources, and they would assume that that's not my child. That's for those who live in that part of Fort Bend County. The rural, but not my part. What are some telltale signs that your child may be involved in dealing with in usage of drugs?
Well, you know, it's very different. It's the individual, it's very individualized, because, you know, historically we'll say, look for grades that are falling, which is a sign, you know, grades starting to change in attitude and behavior, withdrawing from the family, those things, you know, different friends that, you know, different types of friends that you never seen come around, those are signs. But in my experience with working with the teens, you know, some of them have really good grades and are very intelligent, play sports. You know, lots and lots of athletes, track, football, you know, baseball, and they're getting into the experience, heavier use. So it's an individual. I say know your child and have conversation, create a space where they can actually ask you or say, hey, I've been thinking about smoking marijuana. What do you think? I know that sounds weird, but if you create a space to where your child feels safe to talk to you, it reduces the chances of them listen to their friends, because they're gonna come to you first.
Yeah, amen.
And I want to also say, Pastor, that many times parents, we're talking about athletes, right? They have injuries, and then there's dental. Be sure as a parent, when the doctors want to give you that pain medication, just in case, tell them, do not give me an opiate. Kids' brains are so underdeveloped until they're about 25. So any drug that alters the brain alters how they process things. And so not only just the children, but the elderly population is equally is a high number of people who are getting addicted to drugs. So some of the other signs to look for that I find that since COVID, it's really kind of hard to tell why they're being very depressed, because we have a lot of children that are not able to cope with the fact that they do not have social connection with their friends, that they can't go to activities, and that they're pretty much primarily on inside. They can't participate in regular school events. Now schools are starting to open up, and I'm sure that they're trying to get ready for next year. However, I'm seeing a larger number of children that are coming in that's depressed. They're starting to isolate because they feel like they're all alone, that they constantly are seeing the death toll rise and hearing conversations with the police shooting. So everywhere they turn is negative, negative, negative. And you know, like with anything, if you hear negative, see negative, you know, impart into the negative, then your soul is now being in a negative state. So with that said, when they come to us, it might not be substance abuse that's causing them to not dress or to withdraw or lose appetite. It could be depression or anxiety, right? Because they've heard you, they're going to get their feedback from their parents on whether they feel safe. And if your parents are hypervigilant about death and always focusing on dying from COVID and everything, then the children are affected as well. And so we need to be mindful that our words can be life or death, right? We can speak life and death into our children. So you know, just having that, and then gaming is a big thing. Kids are now isolating in their rooms and they're playing on the computer games all day, all night. It affects the brain just like drugs do. And when you have long periods of being in front of the screen. So, you know, make your child come out and have family dinners. Yeah. Actually, this is the time where you can rethink how you communicate within the family.
Exactly.
Ask them questions, you know, say, how is your day? Don't just accept, yeah, no, maybe, because they're one-worders, it's teens. But engage them into conversation. Be open and friendly, you know, play sports, play games with them, you know, so that you can make it available for them to actually discuss what's going on with you, with them as well. And even as an adult, if you're struggling, be able to share about what you're doing for coping strategies. And so we do a lot of mindfulness exercise. We offer a lot of coping strategies, you know, arts and games to be able to deal with some of the depression and anxiety that they feel just because of all of the negative news. Right. You know, sometimes just cut the TV off. Go back to reading a book.
Well, I know, simple novel idea.
Simple thing.
You know, really, in essence, Shirley, you're really saying just be a family again.
Yeah, be a family.
Just in its basic, just be a family. You know, relational, be relational, as opposed to being isolationist. Because your isolation, and God created us to be interconnected. And what you're saying is that the fruit of just isolation. And so they're suffering in silence. And when they suffer in silence, they're gonna act it out. That's what I really hear you saying tremendously. Some more of your team. Let's do some more of your team, please.
All right. So spiritual team. So I have Valencia Hargos is one of my vice president from the Young Women Christian Counseling. I'm sure that they were not prepared to be talking today, but it's important about having connections, right? Stephanie Herndon is another young lady that has been around in my life, and it's important as a woman to be able to connect with all ages, you know, to be able to communicate, to stay on top of things, to keep young and vibrant, to hear and know how to speak and connect. So I just support those young ladies, and they support me. They're in the community doing their thing. You know, they're educated and they have families and they have children. So they keep me young and keep me informed. And then I impart into them wisdom that I learned from being on this road. And then I cannot say enough about Brian Clark. I mean, he is the greatest supporter in my life outside of my parents. But Brian is the head of my house, you know, and being able to know that he prays for me and that he shares with me, but he's also on a mission to reach out and save young men. And so, Brian, would you like to talk about what it means to have strong family support and be a healthy family imparts healthy children?
Yes. Thank you, Pastor, for the invite. Again, a lot of the questions you had about Access Health, I had as well, because, you know, I really didn't know much that there was something available for people to go to. And from seeing what Shirley and Access Health has done over the years, I think it still is a hidden gem. A lot more folks need to know about this. You know, but to the point about family, you know, I was fortunate enough to you know, grow up in a strong family. I know the importance of a strong family, and I think in today's world, you know, there may be differences in terms of what a family is, but it goes back to the foundation. You know, from my perspective, having God number one in your life, and me basically being a covering for the family, and everybody understanding, you know, their role and responsibility in that family. That individually we may all have different things going on, but ultimately we come back together. And then, you know, as I get older, I've just had a passion for young men, whether it's at church or just on the street, you know, trying to impart wisdom into the. I get the general sense when I talk to young men that they're looking for that. You know, they may not necessarily specifically ask for that, but they're looking for somebody they can trust to tell them something positive or give them some guidance. And that to me is now kind of, I want to do more of that, because I just think there's a huge need for that. So, but today I'm here primarily to you know, celebrate my wife and what her team is doing, as well as what you're doing, Pastor. Really really appreciate you allowing this to take place and to get this information out.
Man, this is tremendous. Bless you, Brother Clark. So, Shirley, why Elevate? Where'd you get the name Elevate from?
Because I want them to elevate into wellness. When I think of what God has done for my life, he definitely elevated me from some pretty difficult times. And I didn't want it to have a stigma when they came in for substance abuse services or mental health services. Who wants to say, oh, I'm here for the substance abuse program, right? Or I'm here because I got some mental health issues. When they check in, they say, I'm here for the Elevate program. And it sounds so refreshing, elevated. Right? Who don't want to be elevated? Who doesn't want to be pushed up or raised up? And so when they come into me, I say, look, there's no need for guilt and shame. You know what? You just need help, and I'm here to walk alongside. I'm not here to tell you what to do. I'm here to meet you where you are and get you where you want to be. So, you know, elevate is a term that I use because every morning when he rises, I rise, right? And so that is the message that I want all of my patients to have, is that they can rise from whatever situation they're from, that as long as they're looking up, there's opportunity, right? It's only when you start looking down that there's no hope. And so I would like to, me and Fanta, we laugh all the time. We say we are hope dealers, right? We're dealing hope all day.
That's right.
Like we just go in smiling, just bubbly, and just stopping and checking with patients, say, hey, what's going on with you, right? They don't have to be in my program. It's about giving hope. Amen. It's about meeting the needs of what the people need here. And so we try to make it as one big family. When they come into our clinic, we don't want them to just think that they're a number or a patient number. We want them to know, hey, they remember me as a family member. And we want to open up and spread out the table and just give them all kinds of fruits and vegetables and love and care. You know, like for instance, one of the programs that we have here at Access Health for the children is we have partnered with the Houston Food Bank. So when the kids come in for their pediatric appointments, they can get free breakfast and free lunch right while they're waiting for their appointment. And so we really do try to meet every single need that our patients have, right? If they say they need clothes, we do an annual clothing drive.
You throwing so much good information at us, because our audience is watching and their head may be spinning right now. I say first to know that this exists. And then to say that it's one-stop shopping. That's what stood up. You say one-stop shopping. So for our audience who's watching now, and they're saying, yeah, you know, I've got some issues that I need some help with, whether it's pediatric care or whether it's a trauma or some mental health issues, whatever it may be. Where do they start? What do they need to do?
First of all, they got to become an Access Health patient. So they just start by calling the main number at 281-342-4530. Schedule an appointment to come in and do an assessment and to enroll as an Access Health patient. And from there, once they're a patient, they have access to all services.
How much money do they need to bring? How much money do they need to bring?
They need to not bring any money.
Can you say that again?
They just need to bring their driver's license, their proof of insurance, if they have it, proof of residency. That could be a light bill, a phone bill, utility bill. If they are living with someone and someone is caring for them, then they need what we call a support letter, where that person who is providing them with housing or finances will write a support letter and they bring that in. Once they bring that in, then we can schedule an appointment. And depending on what they, depending on when they go through the process, what they, you know, what group they fall in, the minimum amount of payment that they would probably need is $10 for a visit. Right? If they are in that particular group. Now, insurance is going to be based on whatever their insurance say that their copay.
Okay, because that's what I was going to ask you. So if someone has insurance, they can still come, and their insurance may certainly cover the majority of it. If someone doesn't have insurance, certainly can also come. What about employment versus unemployment? Do you have to be employed to be able to take
No, you do not. You do not have to be employed. I mean, we make it so simple that people don't believe that you can just show up and get.
That's why I'm asking you a question. Okay. Here's another question. Here's another question. Is there a certain income bracket?
No, they can have zero income bracket. Let me tell you, majority of the patients that are in my particular program, they've been using drugs for a number of years, so they're not employed.
Mhm.
Many of them do not have funds. So when they come, they literally come with the clothes on their back. Many of them don't even have a place to stay. So we try to find whatever they need. So we do a lot of case management, right? So if they need medical care, food, housing, shelter, residential, whatever they need, then once they come in and they become a patient, we can do what we call a biopsychosocial assessment to determine what all of their needs are. And from there, we do warm handoffs. Like if it's something that's within the clinic, we literally walk them over. We don't say, here, go call them. No, we do the calling and we walk them over. We walk them through the whole process. If it's outside of our clinic, we make the call with the patient. We don't allow them, give them a number and a brochure, because I've been there, done that. Give them a number and a brochure and say, here, this service is for you, go get it.
Yeah.
No, we actually call through, set it up, and the only thing they have to do is follow through. Now, oftentimes, as much as we do, a lot of people just don't follow through. Now, we can't help that, but we tell them, we're here when you're ready. You know, some of them try this thing a number of times, but no matter how much they try, they know that they got a place to come when they're ready, right? Jaime O'Byrne is one of our bilingual counselors, and he provides treatment for those who primarily speak Spanish and some other languages. He did text me to say he's on his phone and he doesn't have very much power, so he can't open up his camera or talk. But the wonderful thing is that we have a multicultural community. So we see anywhere from island Pacificans to Africans to Asians. You know, we see everything here.
Yeah.
And then we even don't discriminate to those that might not be citizens. Now, we do try to work with those who are going through the immigration process because they need healthcare too. So we do try to help them get to what they need without any kind of penalties or discrimination. So there is literally nobody that can't get services here at Access.
Okay, I've a couple more questions for you. What about someone that they have a job, they're gainfully employed, they have housing, but they have no dental insurance?
Then they can still come in and it's affordable care. So what they would do is be able to pay. Say, for instance, if you came and you got dental service and you couldn't pay for the whole bill in full, then we have what we call a sliding scale fee, where they can put in and do payment plans.
Okay.
Until they pay it off.
Yeah. Okay. Here's another question. What about the person who has a criminal record? There's a history. In fact, he or she may have just only been out 60 days.
Well, guess what? I get them hot from coming out. From jail and prison, right? We don't discriminate against anyone. In fact, we are more sensitive to that particular population because we know that they're up against so much. So we have a lot of resources, you know, that we find that particularly cater to that particular population. And so we keep that, once they come in, we walk them through. We understand that they might not be as well versed with knowing how to contact or feel comfortable contacting. So that even makes it more our responsibility to make sure that anything that they need that we get. Like, for instance, for being indigent care. So there's an application for those individuals that don't have housing or money to pay or the ability to pay for their medication. So we sign them up with For Being Indigent, which definitely will pay for medication reimbursement up to $600 in the course of the year. We also use the Good RX card for those who might want to go to a local pharmacy, and it gives wonderful discounts on the medication. Of course, our pharmacy here at Access Health is a 340B pharmacy, which means that we get all of our medications at a discounted price. So, you know, we try to meet them wherever the problem are. We really try to work hard that everyone, no matter what their situation, cultural background, criminal history, whatever, no one is literally turned away from us.
Sister Clark, you guys are truly a ram in the bush. And where have you been? I mean, why is this secret been kind of, under a rock somewhere? Because what you're saying here is really what people are struggling for, asking for. You're saying that it's available.
It's
You're saying that in order to get the ball rolling, simply just contact Access Health for an assessment at phone number 281-342-4530.
And if I want to show you how passionate I am about meeting the needs, if they want to call me direct and they don't want to go through an automated system, they can call my direct line, which is going to ring at my office, and I will answer and walk them through, like I do many of my clients, to get them to where they are. So my direct number is 281-633-3195. 281-633-3195. So they know who I am. They can call me and I can get them whatever they need. If it means going through scheduling them to become a patient, then I can do that. If it's just getting some referrals to a community organization because they have some special needs, then I can definitely help them. Whatever the need is, it's about me building the kingdom. And that's my role. I take my job as a kingdom building process, that no one should be left behind, that no one should go without. So I'm using the Beatitudes, right?
Yeah.
If they hungry, I'm gonna get you something to eat. If you're naked, I'm gonna put some clothes on your back. Right? If you need some counseling, I got that for you. So no matter what the needs is, that's what my role is to do, is to make sure that you leave different and not the same, right?
Wow. So, okay. I have it. Now I want the audience to get it. Man, this is just tremendous. This is like rhema from above. Thank you for what you're doing, and we want to get the word out. Now, audience, you're listening. You probably didn't see this coming because you've been trying to you've been scratching your head, and you've been praying and wondering, Lord, how can I get the assistance that I need? And what you've heard today, you've heard it from the sister's mouth, is that it's available. Just make the contact, make the call to the office or her. She gave a personal number, 281-633-3195. And we've got people who really help you with your family. I'm glad to have Brother Clark on here talking about want to deal with men, and we want to deal with the adolescents. So we're talking about a really a holistic ministry to bring you to healthiness that you can be able to elevate. No longer to feel as if you've been victimized, but really move to living a victorious life. You're helping people live a victorious life. And so I thank you. I want to give you the very last word before we go. What do you want to say to the kitchen table for those who may be a little hesitant because it seems too good to be true?
Well, you know what? Try it. Just do it. If you know you need help, call. You know, one of my favorite quotes from Theodore Roosevelt says, people don't really care how much you know until they know how much you care, right? So my goal is to always show how much I care first. And then through that, I get rewarded by your life being well. And so Elevate is to move you to new heights of wellness. And that's my goal. That's my mission. That's my mantra, is to just reach out and move you, not just one person, but the whole family to a place of wellness. So, just reach out. I'm available. Wow.
Thank you so much. May God bless you and continue to use you. And kitchen table, tell your mother, your father, your in-laws, your nieces and nephews what you've heard today, and call. As she said, you just got to try it. You got to try it. And so we thank may God bless your going and your coming. That's it, kitchen table. I'll see you next Friday right here at the kitchen table.